Up with us tonight, I'm Scott Martin. Board of Supervisors announced today Baptist Memorial Healthcare Corporation and North Mississippi Health Services as potential buyers of OCH Regional Medical Center. Tonight, Supervisor Marvell Howard held a town hall meeting giving residents a little more clarity on what it all means. Quentin Smith was at the meeting. He's back in our studio with what happened. Quentin.
Scott, it was a packed crowd on hand tonight. Several residents came out with concerns and questions for Howard about the future of the hospital. Some of the biggest concerns residents had was whether or not they'd see a tax cut, would current employees be able to keep their jobs, and what would actually happen to health care in Oktibbeha County if the hospital was sold. Now, it was last week when the board held a special meeting to discuss the bids they received on the hospital. But due to confidential reasons, the board said certain information could not be released. This left some residents feeling as if they were left in the dark. As a result, it prompted Howard to hold a town hall meeting. Howard says he wants to let residents know that he hears their concerns and wants to do everything he can to provide them with as much information as possible before the November vote.
This is not an election that in 4 years, if you don't like what happened, you can make a change. Once this election is done, is done. So I think people are out gathering information and trying their best to get accurate, factual information.
I think it was very encouraging that the number of people who showed up are supporters of the hospital. It's quite evident that some of these people are who have lived here for quite some time. They have watched the facility growth. They've seen what our medical staff has been able to do to improve over the years.
Now, the hospital's CEO, Richard Hilton, says he's not surprised with Baptist or North Mississippi being the two potential buyers. Now, if the hospital is not sold, Howard says the board, the community, and hospital leaders will all come together and think of things they can do to help OCH continue its growth. Scott, back to you.